Could your skin be trying to warn you about your health? Dry skin affects millions of older adults every year. In many cases, it's caused by normal aging. But when the dryness becomes severe, persistent, or appears alongside other symptoms, it's worth taking a closer look. While dry skin is often harmless, it can sometimes reflect changes in your environment, daily habits, medications, or overall health. Understanding the possible causes can help you care for your skin more effectively and recognize when it's time to seek medical advice. Point 1. Why moisturizer alone may not be enough. Applying moisturizer is important, but if the underlying cause isn't addressed, the dryness may continue to return. Aging skin naturally loses moisture more quickly, but dehydration, certain medications, and some health conditions can also contribute. If your skin remains very dry despite regular moisturizing, it's worth discussing the problem with your healthcare provider. Point 2. Hot showers can strip away natural oils. Long hot showers may feel relaxing, but they can remove the skin's natural oils, making dryness even worse. Warm water is usually a better choice, and applying a thick moisturizer within a few minutes after bathing helps lock moisture into the skin. Point 3. Gentle cleansers matter. Many soaps contain harsh ingredients that remove protective oils from the skin. Choosing a mild, fragrance-free cleanser may reduce irritation and help aging skin retain more moisture. Point 4. Don't forget to stay hydrated. Older adults often experience a reduced sense of thirst, making dehydration easier to overlook. Drinking enough fluid supports overall health and may help improve skin hydration, although it won't solve every case of dry skin. Point 5. Indoor air can be a hidden cause. Heating systems in winter and air conditioning during warmer months can lower indoor humidity. Indoor air allows moisture to evaporate from the skin more quickly, leaving it feeling rough and uncomfortable. Point 6. Itching deserves attention. Persistent itching is commonly caused by dry skin, but if it continues despite good skincare, it's a good idea to speak with a healthcare professional. Point 7. Wear skin-friendly fabrics. Soft, breathable clothing is often more comfortable than rough materials that may further irritate dry skin. Point 8. Daily habits make a difference. Simple routines such as moisturizing every day and avoiding harsh skin products can gradually improve comfort and reduce dryness. Point 9. Dry skin can sometimes reflect an underlying health condition. Although dry skin is usually a normal part of aging, persistent or severe dryness may occasionally be associated with medical conditions such as diabetes, reduced thyroid function, kidney disease, or nutritional deficiencies. Dry skin alone doesn't diagnose these conditions, but if it appears together with symptoms like unusual fatigue, unexplained weight loss, increased thirst, or swelling, it's important to seek medical evaluation rather than making assumptions. Point 10. Your skin is more important than you think. Your skin is your body's largest organ and serves as a protective barrier against bacteria, irritation, and moisture loss. When the skin becomes extremely dry, tiny cracks may develop. These cracks can increase the risk of infection if they're not cared for properly. If you notice redness, warmth, swelling, pain, or drainage from cracked skin, it's important to contact a healthcare provider promptly. Healthy skin isn't just about appearance. It's an essential part of protecting your overall health. Point 11. Know when medical advice is needed. Many cases of dry skin improve with gentle skincare and regular moisturizing. However, you shouldn't ignore dryness that becomes painful, causes deep cracks, bleeds repeatedly, or doesn't improve after several weeks of proper care. A healthcare provider can determine whether medications, allergies, eczema, or another medical condition may be contributing and recommend appropriate treatment. Point 12. Moisturize the right way. Creams and ointments often provide better moisture protection than thin lotions. Applying them immediately after bathing while the skin is still slightly damp can improve their effectiveness. Point 13. Protect your skin every day. Avoid very hot water. Use gentle skincare products and consider a humidifier if your home is very dry. Small daily habits can make a meaningful difference. Over time. Point 14. Pay attention to new changes. If your skin suddenly becomes much drier than usual or new symptoms appear, don't ignore them. Even small changes deserve attention, especially if they persist. Point 15. Healthy skin supports healthy aging. Dry skin is common after the age of 75, and in many cases it's simply part of the natural aging process. But when dryness becomes severe, persistent, or occurs with other concerning symptoms, it's worth discussing with your healthcare provider. Taking care of your skin today can improve comfort, protect your body's natural barrier, and support healthier aging in the years ahead. Point 16. Nutrition plays a role in skin health. Healthy skin depends on more than moisturizers. A balanced diet that includes enough protein, healthy fats, vitamins, and minerals helps the skin repair itself and maintain its natural protective barrier. Older adults who eat poorly because of reduced appetite, dental problems, or illness may be more likely to experience dry or fragile skin. While no single food can completely prevent dryness, maintaining good nutrition supports healthier skin from the inside out. If you have concerns about your diet or possible vitamin deficiencies, discuss them with your healthcare provider before taking supplements. Point 17. Some medications may contribute to dry skin. Many commonly prescribed medications can have dry skin as a side effect. These may include certain blood pressure medications, cholesterol-lowering drugs, diuretics, acne treatments, or medications used for allergies. This doesn't mean you should stop taking any prescribed medicine on your own. Instead, if you notice that your skin became much drier after starting a new medication, mention it to your healthcare provider or pharmacist. They can determine whether the medication may be contributing and recommend safe ways to manage the problem. Point 18. Sun damage can make dry skin worse. Years of sun exposure gradually damage the skin's protective barrier and reduce its ability to hold moisture. As we age, this damage can become more noticeable, leading to rough, flaky, or leathery skin. Wearing protective clothing, seeking shade during the strongest sunlight, and using sunscreen on exposed skin can help reduce further damage. Protecting your skin from the sun isn't only about preventing sunburn, it's also an important part of maintaining healthier skin as you grow older. Point 19. Listen to what your skin is telling you. Your skin often reflects what's happening inside and outside your body. Most cases of dry skin are easily managed with gentle skincare, proper hydration, and daily moisturizing. However, if the dryness is severe, keeps returning, or is accompanied by other unusual symptoms, don't ignore it. Paying attention to these changes and seeking medical advice when necessary can help identify treatable problems early. Caring for your skin is one simple step that supports both comfort and long-term health throughout the aging process. Thanks for watching. If you found this video helpful, please like, subscribe, and share it with someone who may benefit. Stay healthy, and see you in the next video.